Much, Mr. Speaker. This government has reneged on the agreement in principle with physicians signed just before the election, where physicians clearly agreed to 0 increases for year 1 and year 2. This is clearly not about money, Mr. Minister. This is about respect and not token consultation, which he talks about frequently. To the Minister, does the Minister not see a connection between our demoralized family physician workforce and these disrespectful negotiations on quality of care for Albertans?
Honourable Minister.
Mr. Speaker, I'm not aware of many governments in this country that have invested willingly and will continue to invest more than 20 months in negotiations with our physicians. It is a reflection, Mr. Speaker, of the trust and the respect that we have for the medical profession. And it is in that vein that this government, recognizing that we are at present in an impasse in those negotiations over fee increases, provided certainty and stability for our physicians in announcing an additional $463 million in support.
Honourable member.
Trust and respect. It's not coming from the profession, Mr. Minister, and you know that. Cancelling the public inquiry into physician intimidation now makes sense, Mr. Speaker, since this government is the bully. Why doesn't the minister just admit that this is clearly part of the Premier's strategy to emasculate the AMA? Admit it.
Honourable Minister.
Well, Mr. Speaker, this is hardly a question of government policy, but I'll take the opportunity to say this. The issue of physician intimidation was investigated thoroughly by the Health Quality Council of Alberta in the report that they released last year. In the report, Mr. Speaker, they suggested that it would not be a wise use of resources for the government to re-examine this through ordering another inquiry to cover the same ground. They advised us to take note of the steps that they outlined in the report to improve the workplace culture for physicians in our province. We've taken that advice, Mr. Speaker. We're well on our way to implementing those recommendations. That's what trust and respect.
Honourable member.
Well, with another deficit of $3.5 billion in this province, this is clearly another desperate attempt to find dollars for the Premier's pet project, family care centres, regardless of the cost to health professionals. Is this the best you can do, Minister, to improve primary care in this province?
Honourable Minister.
Mr. Speaker, I'd suggest to you that in an environment where physicians are facing fee cuts in other part of the province, retaining our position as paying 29% above the national average to physician compensation is a pretty good deal for physicians.